Hello, this is Dr. Maha from Madela's Medical Videos and Podcast, and today I am in conversation with Dr. Faiz, who is a consultant pediatrician. Hello, Dr. Faiz.
Hello, Dr. Maha. Thank you for having me.
Okay, let's start our questions. How do you deal with sick children?
Well, it is very interesting to deal with children. First of all, you have to face the child with his fears, who is afraid of you, afraid of your medicine, afraid from the environment. But on the other hand, for me, I really enjoy those children. I enjoy their reactions, their attitude. So first thing, what you need is just to make the child comfortable with you, have a talk, just try to engage him with stuff. Soon soon you break that ice with the child. And for me, to deal with a child who is irritable and crying, that would be much better rather than dealing with a child who is lethargic, not interacting through the environment. So when the child comes to you, he's full of fear. He's afraid of you, afraid of the environment, afraid from your medicine. So if the child comes like that, of course, you get trained during your residency how to deal, how to engage those children. But the thing is, when you see so much children throughout your residency program and during your work, you know how to deal with them. For me, dealing with a child who is irritable, afraid, would be better rather than dealing with a child who is sleepy, who is stuporous, who's not interacting to the environment.
Exactly, that's a challenge. That's a big challenge, especially these children cannot express their pain or how do they feel. Can you tell us any clues or any tips? How can you, as a pediatrician, reach a diagnosis from the child who cannot express himself or the way he's feeling?
Well, once I heard a saying, and I really liked it, is the simplest explanation is the best explanation. Keeping that in mind, if you just think of what is the simple reason behind that symptom or the reason behind that event, that would be your first diagnosis. But of course, I would like to add to this saying, but first of all, you need to rule out the dangerous causes. For example, like if a child comes with you to you with fever, okay, most common cause would be an upper respiratory tract infection, but of course you need to rule out sepsis. So that is this explanation. For simplest explanation is the best explanation, but rule out the dangerous ones.
So when you are dealing with a sick child, you're not only dealing with the child himself. You have to also deal with the parents, the very worried parents. You need to explain to them. Tell us about that.
Yes, this is really a big part in the treatment of a child. Now, I believe that a good pediatrician must have that empathy towards the parents. And of course, you have that for the child. But having that empathy for the parents, that is the main thing. That is I would say, the cornerstone of the treatment for the child. For me, I believe every pediatrician should be a parent to understand what does a parent feel when they come with a fever. During our residency program, we have been working in the ICUs and dealing with sepsis, shock, and of course, when a parent comes or a fearful parent come with a fever, you find it silly. Oh, this is nothing to worry of. But if you're a parent, that fever, the fever he comes up with, needs so much counseling, needs so much. You need to address, what I mean is you need to address that fear that the parent is having. If a child comes to you with upper respiratory infection at the middle of the night, don't get angry. Why did he come right now? Why didn't he come in the morning hours? Because you don't know what the parents are feeling. So you should have that empathy. That is the most important thing while treating children.
Okay, that's good. So, what is your advice to young doctors?
Well, once you're in this field, once you have come to medicine, you should understand. You should understand that you're a messenger for health. You're just not dealing with a specific disease. You would treat, of course, that disease, but you are also responsible to send the message to his family, to the environment, to the community, how to prevent diseases, how to overcome dangers to the humanity. So you're basically a messenger, and you should not just take care of patients, you should take care of the surrounding of the patient. You should forget that this field would bring up money to you. This field that you chose is a responsibility that you should maintain the community health. It's not just about a disease. You're not just dealing with a disease. You have to deal with the environment by itself.
Yeah, that's true. So recently you've been working in a developing country. How was that experience?
Well, working in developing countries is challenging because you have limited resources. You have limited laboratory tests, limited facilities to entertain your patients. But you come across a lot of diseases that you would not see in the developed countries. The main limitation while working in developing country is the limited resources that a pediatrician or any physician would have. You have difficulty while reaching the diagnosis, especially for diseases that needs advanced testing. You need some medicines that are not available to you, and the parents or the family members are unaffordable to get some expensive medicines. These are limitations that you find. But the good thing while working over here, I have seen consultants, I have seen good doctors trying to bring these facilities from the West and trying to bring them up in the country. And this thing, I really respect that doctors over here, doctor community over here, they are trying their level best to bring the facilities from the West and bring them to their country. And I would wish that the doctor community in different developing countries would have this thinking rather than just blaming or just complain that we don't have those facilities. Well, we have the connections. You have the connections. You have the power to say, and many things can be done. Many things we can work on and bring into the country from lab tests, from medicines. The doctors should have only. They should just put some effort.
Okay, let's say if a child comes with the difficulty of breathing, what will be your steps?
That's a common scenario that any pediatrician would face. But remembering what I told you, the simplest explanation is the best explanation. So you know that the most common causes are acute upper respiratory tract infection. But as I said, you have to rule out the dangerous ones. What I mean is that with the difficulty of breathing, I know it might be an upper respiratory tract infection, but I have to rule out the lower respiratory causes. And for any pediatrician, they know that according to the IMCI, first of all, you have to assess the respiratory rate. If it is above the normal for age, then that is how you proceed by thinking you have to rule out pneumonia. It is known that pediatricians need to have an eagle's eye, and they need to identify the whispers of danger signs. So I think that concludes what you need to look for any pediatrician.
Okay, diarrhea in children. Can you tell us any tips for parents and for young doctors how to deal with diarrhea in children?
Diarrhea is one of the common symptoms that children would come up with to the emergency or to the out clinics. So first of all, you need to assess the hydration. And for a pediatrician, he needs to assess the hydration. And the most important thing in the management of diarrhea is just to replace the losses. So one thing for the parents is diarrhea per se. You need to give lots of fluids to a child. And for a pediatrician, the go-home message is assess the hydration status, counsel the parents about the hydration of the babies.
So the main thing is the hydration. It's not important to give them antibiotics. What about the misuse of antibiotics in children nowadays, seen in every clinic?
Well, this is a major issue, and all pediatricians know about this. And now the thing is that we have to convince parents rather than pediatricians not to use antibiotics, because now it's so commonly used by parents. They by themselves start the antibiotics. And what I would tell them is mostly diarrhea in children is caused by viruses. So if you give whatsoever antibiotic you're giving, it will not be of benefit. What you should take care of is the hydration of your child.
Okay, what about the UTIs in children? It must be very challenging to diagnose a UTI in children. Is it or not?
Oh, yes. Remember what I told you, that there are diseases that whispers to you, and this is one of the illnesses that whispers to a pediatrician. The child would come usually with fever, without focus. And that's or that is the first clue to any pediatrician. Or sometimes a child would come with failure to grow. And what we find is the reason behind that is just a UTI. So hygiene is the most important thing to prevent UTI.
Okay, what about child psychology? Children nowadays, due to social media and the use of these electronic devices, they must be suffering of anxiety and depression, all these. Do you see these things coming in your clinic?
Oh yes, this is what we call the disease of the era. That social media brought a lot of benefit, but also it has caused a lot of problems. We see speech delay, we see anger issues, and this just is because of the accessibility that these platforms has brought. And the thing is, the role lies on the parents, is to decide at what age they should give their children the accessibility for these devices, and to monitor the content they are looking at, and to regulate the amount of time spent while using
How much time do you advise?
Well, many guidelines have been released, but as a general rule, below 2 years, it should be 0. So no phone below 2 years. And later on, not more than 1 hour.
Oh, okay. Thank you so much, Dr. Faiz. It was lovely having you. Hope to see you in other episodes. And anything you would like to say at the end?
Thank you very much for having me. It was my pleasure. And just a message for doctors that after choosing this field, you should believe that you are a messenger. You're a messenger for health, so you should not just take care of a disease by itself. You should take care of the environment of the patient, environment of the families. So you should be addressing those issues. Prevention is better than cure. So if we educate people, many diseases we can prevent.
Okay, thank you so much, and see you in another episode.